I'm a gadget guy. I don't mind saying sometimes something gets my attention purely because I think it might be cool. What if you could do alcohol detection just by touching a device? What might that mean for workplace safety? How might AI impact it? And where does the future hold? David Gandini, who's the CEO of SOBRSafe, joins me, and we learn more about the technology on this bonus episode of The Business of Tech. This episode is supported by Comet Backup. Are you seeking a fast, secure, and flexible backup solution? Comet Backup empowers you to manage all your backups from a simple, centralized platform. Protect Windows, Linux, and macOS, as well as Hyper-V, VMware, Synology, Microsoft 365, and more. Manage backups on your terms. You choose where the data is stored, with on-prem storage and direct-to-cloud with industry-leading integrations like AWS and Microsoft Azure. Experience streamlined data protection and disaster recovery tailored to your needs. Visit cometbackup.com to start your free 30-day trial today. Get $100 free credit when you sign up with the promo code MSP Radio. Start running backups in 15 minutes or less with Comet Backup. Well, David, welcome to the show. Thanks for joining me today.
Thanks, Dave. Good to be here.
Now, I'm super curious because you've got a technology called SOBRSafe, which is focused on alcohol detection within employee bases. Now, this has got a couple of elements that I'm really fascinated in as I think about employee monitoring and some of the artificial intelligence. But I think it's worthwhile taking a quick moment. Tell me what the technology does and what problem it's solving at a workforce.
Yeah. Keep in mind, it's workforce as well as behavioral health and consumer. So we're in a couple of different markets. But how the technology works, we have two devices. First one is a stationary device, the SOBRCheck, and it has a biometric identifier, put your finger on, and it has a reservoir where our sensor and our technology is. So if you're checking into a facility, for example, oil and gas, we have a customer with 16, 17 locations. So to make sure they're safe, at the beginning of the day, when an employee checks in, they put their fingers on the device. If they're alcohol free, that goes to a database. The manager can manage it from one of those 16 locations to make sure that employee's safe, and they move on to work. If they leave for lunch, they check in, check out. So they may check in, check out 4 or 5 times a day. But what our technology does, it looks for ethanol vapor coming from the skin, which then the sensor triggers. Our algorithm then determines if there's an alcohol situation, and it reports into the database.
Gotcha.
With the second device, which I have on right here, which is the SOBRSure device, it's very slick, very Fitbit-like, and same technology. It pairs with a phone, and the same thing. If you have alcohol, if you've been drinking, it picks up that ethanol from your skin, and it reports into the phone, which then reports into a dashboard. So whether you're in behavioral health and you're managing 50 or 100 individuals that have alcohol use disorder, you're able to react and you're able to work with those individuals. In the case of employer, they would go to that individual and check again, usually using a breathalyzer or another method. All we are is a front line. We're not a medical device. We're just saying there is alcohol in your system or not.
Okay, got it. Now, this brings up, before I get into sort of the interesting technology bits, it also brings up a lot of employee privacy questions, right? Because you're handling information that is either defined as healthcare information or very distinctly healthcare adjacent, right? So there's a lot of, talk to me a little bit about the way you've put together frameworks and the way you approach privacy of this data.
Yeah. So all the data is de-identified. So there's no one's name or there's no fingerprint that we're storing. All we're doing is looking for fine points on one's finger. So we're not storing a fingerprint. So we're not in a situation where we're storing personal or HIPAA related data. It's de-identified data, and it's certain points on a finger, not a fingerprint. So we've been able to not have to abide by any HIPAA requirements because we're not storing your information. It's de-identified.
Gotcha. So, and actually, I'm sort of curious then, if it's at the time of the transaction, analysis is done right there. What is retained about that? Is it just sort of
whether or not there was the presence of alcohol and an ID number that then relates in the employer's database to that individual?
I see. Okay,
so the employer stores the data, not us. We store a number.
Gotcha. Now, I'm really curious. You've also you're leveraging artificial intelligence to improve the accuracy and efficiency. Talk to me a little bit about what you're doing and some of the enhancements you've been able to do with AI, and I assume some level of machine learning.
Yeah, so we are just beginning that process, and we will start with machine learning, which is under the umbrella of AI. The objective there is to be able to normalize each user based on their physiology and their environment. So we may have different levels of normal for you or myself, depending on if you work in an oil field in Texas or I'm in Phoenix, Arizona in an office. It's to normalize the baseline for individuals. So we're just at the very beginning of that process, Dave.
Okay, gotcha. So that makes me kind of curious. So what are the areas that you think you're going to be able to see improvements on based on sort of using that style of technology?
Yeah, the improvement would be specifically around for the band. Couldn't do it with the check because you might have 1,000 individuals that are using the same box over any period of time. It's a point in time. But with the SOBRSure, it is, again, taking the individual, the environment that the individual is in, and being able to normalize their baseline to eliminate more false positives. Example, in Texas, in any of these oil fields or these locations where these individuals work, there are vehicles and there's emissions from those vehicles, ethanol. So in those environments, what we had to do is we had to manually dial up the baseline to accommodate for the environment. And in the future, with the band, we'll be able to not have to manually do that. We'll do that based on an automated basis as we collect data from machine learning, and we'll be able to then put that into an AI. So we're not in that today, but we're in the beginning phases of that. We need many more users and much more data to get there, but that is on our roadmap right now.
Gotcha. Now, it also feels, what's interesting to me is there's kind of two very different use cases with the two styles of product that you have. I've got kind of like, in a sense, a really clear, there's a transactional moment. I'm checking a moment in time of this employee for safety reasons. Then you've got another set, which are much more around sort of lifestyle and which are around adjusting. Talk to me a little bit about the way you think about approaching those two different use cases, because they are very different leveraging the same technology.
Yeah, well, I think you hit it, Dave. The SOBRCheck device is a transactional device, right? You're checking individuals as they come into the facility, leave the facility, come back to the facility. And that's one way of managing whether or not individuals are partaking in alcohol use outside the company when they go back in for lunch. So that's very transactional. And what that does is it gives the business owner or the safety manager the opportunity to work with these individuals if they see a problem. The ban is really focused around behavioral health. I mean, I think there are 46,000 behavioral health facilities in the U.S., and they're managing alcohol use disorder. This year, Dave, 30 million individuals are trying to find some way to better manage their AUD. So in this scenario, behavioral health, you go into a facility, you're being managed by a clinician to stop drinking or to minimize your drinking. With the band, we're able to, it's almost like a support partner, but the difference is it's very discreet, it's very private. And so you wear the band, Dave, if you're my clinical manager, you know what I'm doing, where I'm going, and if I'm under any alcohol use at that point. So what we're doing is we're giving these behavioral health facilities and these clinicians the opportunity to really work real-time data discreetly rather than blowing into something to help these individuals manage their situation.
Gotcha.
There's also, we have a dashboard, and you have the ability to have the stationary device and the band in a facility so you can manage the individuals. And if there is an alert, it'll come up on your dashboard and you can react. And we also have GPS location too. So if there's somebody in trouble, you know where they're at.
I see. Now, I would think that the continuous monitoring element does have certain elements that have some privacy issues that you need to wrap around, because location data is very sensitive. Anything related to healthcare, even just perception of it, even if it isn't fully HIPAA compliant, has some of that. And of course, there's the app and an online portion of that. Talk to me a little bit about how that portion works from a data management perspective.
Well, so far, and we've been in this space for about 13 months, if you're part of a facility and you're getting treated, then you have you've signed off certain documentation, and this becomes just part of that process. And in terms of this consumer that's using it, I mean, we have a user license agreement that defines what we can do and what we can't do. And when you sign off on that, you accept it. So as far as we know today, Dave, we don't have any specific privacy issues that we're dealing with because we've labeled everything up front with the user license agreement. So I'm sure things could change, but right now, we think we're in control of our destiny with the de-identified data that we have, the protection that we have around it, and the license agreements that are being executed by the user.
Gotcha. Now, one of the things I'm always sort of interested in with executives like yourself is how you kind of have set up your organization, because I think that, the way you build your org and your org structure sort of allows you to lean into certain priorities at different speed. Talk to me a little bit about the way that you've set up the org.
Well, yeah. So as you know, I think we talked a little bit about this, or I saw in the document that you sent that I had, years and years of telecom experience, right? And what we learned at telecom is you don't necessarily need to build everything. You can swap. You can locate in other people's points of presence, and you can trade miles for miles, and you can grow your network. So basically, from my perspective, when I came into this business, when we started, I didn't want to build an engineering organization because from my perspective, they're expensive. How do you keep them busy all the time? So the first thing we decided to do is we would co-design and work with an engineering firm to develop the technology, which we did. We did the SOBRCheck, the stationary device. We did that, believe it or not, Dave, in about 12 months time. And we did most of the engineering work early on. The SOBRSure band, we did in, I think, about 18 to 20 months. And we did it pretty successfully, assuming, I don't know if you know this, but there are really no other working alcohol detection bands today in the market. There are some that are out there, but they're not quite functioning yet. So what we decided to do is we would outsource engineering with an engineering lead so we could save costs and headcount there. And then we're working with a company called Sienna that does all of our manufacturing. So we've outsourced manufacturing, and they're a fairly high-end group. And I think for the band today, we're about 98% fully automated in producing the band with all the QC parts and pieces around it. So we have inside sales, we have inside marketing, we have inside finance, and then we have outsourced engineering and manufacturing with leads on top of that. And then we've also have inside customer service today, but as we grow, probably in the next 60 to 90 days, we've already got several outsourced vendors. We'll use chatbots with all the normal things we need to do to service the customer, and we'll transition probably in the mid-late second quarter. So outsource customer service, outsource engineering, outsource manufacturing, sales, marketing, finance inside. Right now we have 16 employees.
That keeps you super agile. So give me, now that I've got a sense of the way you set up the org, how, as you, the leader, do you approach decision making? Like, particularly as you're thinking about decisions like integrations of new technologies, talk to me about your framework for decision making.
Yeah. I mean, in terms of, I come from the startup mode. I think this is my 6th startup, and I've learned a lot, and I've scraped my knees a lot, and I've had a few doubles off the wall, 1 home run, but I've learned a lot in the process. So one of the things that I've learned is you can't be overreactive and too quick to make a decision. Example, you're spending X amount of dollars marketing to consumers. And as you know, Dave, takes time, take money. When do you take your foot off the gas, and how have you built your ROI model? So we very specifically focus around ROI modeling. Again, we have a new product. There's no way to really compare it. So we're very conservative in how we build our models, and we manage those models until, as a team, we sit down and figure, is this working for us? What does the ROI say? What do the numbers say? And then we'll look at making some shifts, but we do slight pivots, but we don't do about faces. So we really manage around ROI, and on the same thing with sales. We're brand building right now. What we're looking at is how do we drive leads and the money that we're spending per lead, and that lead turned into a sale. What's our cost to do that? Is there a different way, a better way to do that?
Well, you've teed me up for my last question then really well. With a windshield view, say, I like to use 18 months, but we'll use your 16 months there. give me a sense of kind of what are the major trends, either around the business space or technology that you're keeping an eye on in that through that windshield.
Well, I mean, first of all, it's the competitive landscape. And right now, the competitive landscape for us is breathalyzer. There are some bands in motion, but breathalyzer. And for us, the function of alcohol testing and behavioral health is already set in motion, and there is a competitor there, and that we're going after that percentage of market share from that competitor. And in terms of what we see changing, we could be much more significant. You brought this up, talking about machine learning and AI. I mean, what if we could monitor each individual on an ICB basis? I mean, what would be the value of that and the value of the data that comes from that? And then also, Dave, the data that we're driving right now, it's not significant enough, but the data that we're driving, we're talking to insurance companies right now about what ifs. What if we could say that Dave is 24/7 sober? He's never gonna have an issue when he gets into his vehicle. Does Dave get some kind of discount? What if we can validate that a company has 100% alcohol free in manufacturing? Is there a discount? So our eye is really on machine learning, AI, the value of data, and then what does the next version of the product look like, which we already have some ideas. And also, Dave, in vehicle, we're doing some testing right now for in vehicle application where you're not blowing as you're driving your car, you put your finger on it. And we've also expanded. We're in Australia and New Zealand, where they have slightly different rules of engagement for alcohol use. And we're seeing some progress there. But really, just looking at competitors, the roadmap, what we can do to our product as we get more information from customers, and then how can we leverage effectively to create more value for ourselves and for our customers using machine learning.
Well, that is a fascinating vision. David Gandini is the Chief Executive Officer of SOBRSafe, a company pioneering next-generation transdermal alcohol detection technology. He's a serial entrepreneur with a distinguished track record in telecommunications, technology, software, and automated packaging. David, thanks for joining me today.
Thanks very much, Dave, for your interest. Appreciate it.
With every new breach and threat that I cover, it's clear that cybersecurity isn't a luxury anymore. It's a necessity. That's where Huntress comes in. Their fully managed cybersecurity platform is built for every kind of business, not just the 1%. Huntress seamlessly integrates their products and threat hunting team. Their EDR, ITDR, SIM, and security awareness training solutions are purposely built for their elite 24/7 security operations center to stop threats before anyone else even spots them. This potent combination of purpose-built cybersecurity and threat hunting expertise is one of the many reasons why G2 users have voted Huntress the #1 rated EDR for growing businesses. To see what people-powered cybersecurity looks like, visit huntress.com/MSP Radio. The Business of Tech is written and produced by me, Dave Sobel, under ethics guidelines posted at businessof.tech. If you've enjoyed the show, make sure you've subscribed or followed on your favorite platform. It's free and helps directly. Give us a review too. If you want to support the show, visit patreon.com/MSP Radio and you'll get access to content early. Or buy our Why Do We Care merch at businessof.tech. Have a question you want answered? We take listener questions, send them in, ideally as a voice memo or video to question@mspradio.com. I answer listener questions live on our Wednesday live show on YouTube and LinkedIn. If you've got a comment or a thought on a story, put it in the comments if you're on YouTube, or reach out on LinkedIn if you're listening to the podcast. And if you want to advertise on the show, visit mspradio.com/engage. Once again, thanks for listening, and I will talk to you again on our next episode.
Part of the MSP Radio Network.